to video M in our A to Z series. Today we are going to be looking at more accurate diagnosis. Accurate diagnosis leads to effective treatment plans. This helps ensure that patients receive the correct treatments at the right time, which improves their chances of recovery and overall health outcomes. Misdiagnosis and delayed diagnosis can lead to ineffective treatments, worsening of conditions, and potentially severe consequences. So what can doctors do to help with this? Comprehensive patient histories and thorough examinations. Gathering detailed patient histories and performing complete physical exams provide valuable information that can guide the diagnostic process. There's also differential diagnosis, so evaluating and ruling out multiple causes of symptoms. Follow-up and reassessment. So schedule follow-up appointments to reassess the patient's condition. This allows for monitoring changes in symptoms and adjusting the diagnostic approach as needed. So what can patients do? They can share all details of all relevant symptoms, medical history, and lifestyle factors. They can also get a second opinion, so seeking specialist advice for additional perspectives and additional insight can make a world of a difference. It can confirm diagnosis and lead to more effective treatment. How can medical writers contribute? Medical writers can ensure that clinical findings and patient histories are documented clearly and accurately in medical reports such as narratives, research articles, and clinical trial summaries. Medical writers contribute by integrating the latest research findings into clinical guidelines, treatment protocols, and educational materials. This involves reviewing literature by conducting thorough reviews of current research to ensure that recommendations are based on latest evidence. Also, by helping to update clinical practice guidelines to reflect new evidence and emerging diagnostic criteria. So what is the impact? Accurate diagnosis can lead to timely, appropriate treatments, reduced risk of complications, and even save money on doctors' visits. As medical writers, we have the responsibility and opportunity to underscore the profound impact that accurate diagnoses have on patient outcomes. By crafting clear, comprehensive, and evidence-based content, we can support better diagnostic practices, contribute to improved health outcomes, and ultimately enhance the quality of patient care. Our writing not only informs, but also influences how healthcare practices evolve and how patients experience their care. For our call to action, when writing content that supports more accurate diagnosis, focus on clear symptom descriptions that patients can easily relate to their own experience. So instead of vague phrases like severe pain, use precise descriptions such as sharp stabbing pain that occurs suddenly in the lower abdomen. Encourage the use of time frames, locations, and intensities. This helps patients accurately report symptoms to healthcare providers, leading to more informed and timely diagnosis. Staying updated on regulatory and compliance standards for medical documentation ensures that all materials meet industry requirements. Regulatory guidelines, so adhering to guidelines from regulatory bodies like the FDA, EMA, and other relevant agencies can be found on the FDA website. Thank you for listening.